Thinking about hair transplant and not sure what to expect? Hi, I'm Dr. Jin, and let me walk through what that journey might look like for you. So, when you're considering a hair transplant, it all starts with a consultation. Are you the right candidate for it? For me, I like to take my time and discuss what options patients have gone through before and currently going through and what their expectations are afterwards. I mean, if you are someone who is bald and don't have any hair to transplant from, you're not a good candidate for it. If you have mild or moderate thinning or a younger patient and you have healthy follicles, then typically you are a good candidate for it. So it all starts again with a good and thorough consultation to get you prepped for it. After it's decided that you want to pursue hair transplant, what I like to do is start my patients on a hair supplement. I like to put them on Viviscal Pro anywhere from 4 to 6 weeks ahead of time in order to get the nutrients in their scalp around their follicles, not only for where we're going to be transplanting and placing, but the follicles that we're actually taking from. This really helps ensure and maximize the viability of those transplanted hairs. Now, what do we expect on the actual day of the transplant? Typically, they start early. My technicians and myself, we can start from anywhere from 6 to 7 a.m. and we prep the patient. What does this mean? This means, again, going over the whole plan, drawing out the lines where we're going to be transplanting the hair, discussing where we're going to be taking the actual hairs or follicles from. And it's basically split into half days. The first half of the day is about getting the patient comfortable, ready, and extracting all the follicles, ranging from a few hundred all the way up to 3,000 or 4,000 follicles. Yes, it's time consuming, can be very tedious, but this is crucial in terms of being able to successfully extract those follicles intact and then to be able to keep those alive during that period before they get transplanted in other parts of the head. So typically that's about a half day. Then the second half of the day is taking those follicles, whether they're singles, doubles, or triples, because sometimes when we think about, oh, I'm taking out one follicle or one hair, when you actually take it out and you look at the root, some of them actually have 1, 2, 3, or 4 different hairs in them. Sometimes that'll require splitting that root or that follicle up, so it'll make your hair pattern look way more natural. Again, the second part of the day is taking all of those extracted follicles and transplanting them into whatever area of the head in a natural way. This again does take a lot of time, and it really is an art in terms of placing the depth, the direction, and just the flow of what the follicles look like to ensure success and ultimately a natural looking result. So in terms of the overall process, the actual day of the transplant or the procedure is typically an all-day event, again lasting anywhere from 8 to sometimes 12 hours depending on the number of follicles. One of the questions I get asked a lot is it painful? Does it hurt? Am I going to be put under a general anesthesia? So typically the most painful part of the procedure or most uncomfortable part of the procedure is the very beginning, where a lot of times they'll do local injections of lidocaine. After you're properly numbed up, you typically don't feel anything. You might feel a little bit of pressure, you might feel a little uncomfortable here and there, but overall, the extraction process in the first half of the day, all the way to the transplant process in the second half of the day, should be actually relatively comfortable. Now, what can you expect afterwards at the end of the day? Yes, you're going to be a little swollen, you're going to be a little sore, you're going to be a little bit tender, but this is where following the post-procedure instructions will really help ensure success of the treatment itself. Another common question I get asked regarding hair transplant is, do I need to shave my head? Or what do I need to shave or not? Some places will actually shave your head, shave everything down to 0, pretty much where they're extracting from and where they're transplanting to. What I like to do in order to create minimal downtime is only shave the areas that need to be. Typically the areas that need to be transplanted, meaning where I want to move the follicles and transplant them, I typically don't shave it. That way we can ensure kind of a more natural look and actually decrease the amount of downtime in terms of my patients or you being able to go out and kind of resume your normal day life. The only place that we do shave is the area that we're actually taking the follicles from. Now, there's different ways of doing it. If you have someone who says, yeah, I can be away for 10 days to 2 weeks, you can go ahead and shave them. That's a very easy way of doing it, and sometimes you have to do it. Now I have other patients with longer hair, both men and women, where what you can do is literally keep the hair back here intact and basically kind of carve out a little section in the back and shave that, but cover it with their existing hair. So really at the end of the procedure, you can't tell that they had anything done to the back of the head. It looks very natural, and again, really helps them get back to their normal lives and minimizes the downtime. So again, there's different ways of doing it. Typically though, you don't have to shave areas where you're transplanting to, and you can be very selective in terms of where you're taking follicles from in terms of shaving. So in terms of the aftercare, in terms of maximizing results, there's a couple crucial things that you should always remember. One, you're gonna be swollen, right? You had all this local anesthetic injected into you, you had hairs that were plucked out from you, hairs that are transplanted in, so you are gonna look a little swollen. So in order to maximize your results, what you don't wanna do is create more pressure in your scalp. The way about doing that is try to maintain and sleep upright or semi-upright at least for 2 or 3 days afterwards. This can help with all the lymphatic drainage to go back towards the back of the head rather than in your face and in front of you. Secondly, you also don't want to shower, or you don't want to have water hitting those follicles, especially within the first 48 to 72 hours. Basically, you want to give your grafts enough time after they've been transplanted to really stick there and be able to withstand any type of stress or pressure. So the way to do that is basically for about 24 to 72 hours, you're not going to shower. What you're going to do is you'll leave them as is, and you're going to take like a warm cup of water with some like Johnson's baby shampoo and literally just pour it gently over the follicle area. Or you can just wait 48 to 72 hours afterwards to, again, using this pour method. You typically want to incorporate this method for up to 7 days afterwards, and then what you can then do is lightly shower. Again, you don't want to put too much direct pressure or trauma onto those follicles, but typically after 2 or 3 days, the follicles that are in, they're pretty much set and they should not be falling out. For long-term maintenance after hair transplant, some of my patients think, oh, it's all said and done. We've transplanted the follicles, we're good to go, and my hair will just grow forever. True, but not true, okay? What you wanna do, again, is continue feeding or nourishing those follicles, right? So, again, having good building block, having good supplement like Viviscal Pro, and then incorporating kind of non-invasive procedures such as PRP or exosomes in terms of microneedling, about 6 to 8 weeks afterwards, after the actual treatment itself, the transplant, will really help the follicles grow much faster and thicker. And then another question I get asked a lot is, when do I see the actual full result? Okay, hair takes time. Hair grows really slow. It's like watching grass grow, literally, right? So what I usually tell my patients is, you won't see the full extent of the result until about anywhere from 8 to 9 months after the hair transplant procedure. So don't get discouraged, but always stay positive and stick with a good routine, knowing that eventually over time, your hair will grow back where the follicles have been transplanted. And lastly, a misconception about hair transplant is a lot of patients think that one transplant is a one and done. All they need is one and they're good. But really, in reality, is to get the best results, what I like to do is I will do a bigger case transplant. It might be a couple thousand follicles. And then I will usually have my patients come back after about a year or so, reassess. And if there are areas that need to be densified with more follicles, you can always do a mini transplant afterwards to really get you that fine-tuned look that you're looking for your hair. So I hope this video has helped describe what a journey for you would look like in terms of hair transplant. If you found it helpful, feel free to leave comments in the comment section and subscribe for more. Thanks again.